Return to Wisdom is a space where we will explore subjects like relationship, motherhood, and health through a new lens. Bring a curious mind and an open heart and get ready to delve into the deep with your host, Kashia Tonyazzini. True story. I used to get panic attacks, and when I went and investigated this, it turns out I had low iron, something 1 in 3 of us have. Now, regular iron supplements, gross. They're full of synthetics. Your body doesn't even absorb it, and be honest, inflammation. So when I found this supplement, I just had to share it with you guys. It is Great Spirit. They are organic, synthetic free. It is all whole food based, and they're produced here in Australia. I cannot believe the difference I've seen in my energy levels and no panic attacks. So if you want to check them out, you can head to greatspirit.com.au. Use the code KASHIA20 for 20% off your first order and enjoy feeling good again. Before we get into today's show, I firstly want to thank you for being here. It is because you tune in each week that I'm able to continue on, and I really appreciate your support. Secondly, if you enjoy the content, please head on over to the homepage of the show. Hit subscribe, like, share, and please review the channel. It would mean the world. This is a small way you can contribute to better guests and greater conversations. Now, without further ado, you're listening to Return to Wisdom with Kashia. Welcome everyone to Return to Wisdom podcast. Today I have Dr. Paul Turke in. Dr. Turke is a physician, a pediatrician, an evolutionary biologist and author. And today we're going to be discussing some things I think that a lot of you are going to agree with, are going to be excited to have this information, maybe pass it on to relatives. But Dr. Turke does look at our evolutionary biology and how our ways of parenting in modern societies are just misaligning with how we used to do things. So welcome, Dr. Paul Turke.
Hello, everybody. Pleasure to be here.
No, I'm really excited to have you here. I think that this information is so vital, and it is so great when, as I was saying off air, when we can find people who have gone through years of research, study and experience and have come out of the allopathic medical system and understood that actually some of the things that we're implementing just isn't aligning with the way that we're parenting, the way we're looking after our sick children. And there is a more biologically sound way to do this, which is it's necessary. So thank you for coming in. I do really appreciate your time. I guess today, Paul, where we could start is there are some really prominent voices out there, such as Gabor Mate and Dr. Erica Commissar, who are talking about or emphasizing the importance of the first 3 years in a child's life and how the primary caregiver should be there for the child's first 3 years. And I was wondering if there has been any like evolutionary biological stance on that, and if it coincides with each other.
Yeah, well, I mean, I think that over the course of our evolution that, the mother and fathers started to come onto the scene and be good parental caretakers way back, millions of years ago, before we were Homo sapiens even. So they're very important. There's all kinds of biological mechanisms, or what we tend to divide the world, things that are like hormonal and whatever, we call those biological, but behaviors we tend not to, but really behaviors are as biological as hormones. But anyway, there are things, like hormones that are bonding hormones and so on, that if mom and baby are separated early on or don't spend enough time with each other, that some of those things don't develop properly, and so on. So there are those kinds of things, but also, just if we step back and look at the way children used to be reared, pretty much universally, it was, mom and dad at the center, but not the care wasn't concentrated on them nearly as much as we find that it is often today, and that's because there's no other helpers. So then the alternative becomes, you ship the child off to some a daycare or some other center to help watch the kid, which isn't necessarily all bad if they're really good and there are some committed caretakers around and the child isn't too young. But I don't think it's easy for anybody who's hired onto the scene to come in and sub for mom, dad, grandma, grandpa, aunts and uncles, older siblings, and so on, which always used to be part of the care matrix. So children had just so many different types of support or people to go to for support, like we were talking about first off air. If somebody's doing a bad job of it that day, somebody else can step in and say, hey, let me help out here. Let me take care of the little one for a bit and go collect yourself, that kind of thing. And so when we don't have those supports in place anymore, those supports which have been there not for hundreds of years or thousands of years, but millions of years, we can expect consequences when those things are radically changed. Now, let me say, humans, if anything, we're adaptable, right? I mean, we've evolved in warm climates, in jungle savanna settings and so on, but we moved into the Arctic and we've done well there. I mean, we can adjust to a lot of different things, but if you're trying to optimize, you might not pick the Arctic for your homeland, but you would, if you're optimizing again, you would choose to have other committed allo parents around, other caretakers who can step in and help. And everybody has different things to offer. Grandma has a set of experience, and grandpa does, and older siblings do. Older siblings, played a fairly big role. It's not as though they were, they weren't marshaled into childcare all the time. Everybody would sort of play together and they would assist one another, that sort of thing. And in a really good daycare, you can find some of that. You can find kids of different ages helping each other, that kind of thing. But I don't think it's easy to substitute for, committed relatives who really start off with the baby and grow to love the baby and so on. So, yeah.
I think that's like a really important point to make, because I know what I see around me, and I guess what is really common in modern society is that you either have mum at home with the kids, stay at home mum. Generally, people move away from their family. I think there's a lot of reevaluating how systems were working and trying to do the best and thinking that that's completely opposite to what your parents did. So you move away and you don't let them help and that kind of thing. And now we have a whole cohort of families who are really struggling. There's a lot of pressure on them. There's a pressure on women to go back to work. And I think and also pressure on women who are just struggling if they're staying home with their kids, why can't you handle this? And I think it's really interesting to look back at what kinship networks actually did and what they provided us And yeah, it wasn't like we haven't evolved to do all of the heavy lifting by ourselves. And
Exactly.
yeah,
Yep.
and then I guess before we jumped on, I did speak about like the popularity of mum rage and how we're all talking about, oh, mum rage, and oh, it's kind of okay to mum rage because like every
Yeah.
mum is kind of feeling that.
Yeah,
Um,
that they're over committed in many situations, and maybe you want to talk about this later, but I think uh, there's a lot of unhappiness, and I don't know if it's rage, but in grandparents too. In the U.S., I think the number is 24% of women in their 60s and beyond are on antidepressant medications.
mm,
And, if you talk to almost any grandma who's hanging out with her grandchild, there's nothing better than this. Now, I mean, again, they don't want the full burden either. They don't want to be 24/7. We like to spread it out, but I think that the elderly get a lot of satisfaction out of being helpers if the children are available. Now, again, as you said, we're mobile, and so sometimes you're if you have a 20-something daughter and she just got married and having a baby and she has to move far away for her job or her husband's job, that's tough, and that happens, and those are pressures. But I think that knowing about our evolution and how we are designed to feel happy for being helpers, that the both sides, the younger people and the older people, should make effort to try to stay together or come together more often. Um, Maybe I should explain from an evolutionary point of view that 6 million years ago, when we split off from all the other apes, we lived about 40 or 50 years as a maximum amount of time that we could live, just as they do now. And the way that we were able to hold off aging in order to live longer was by keeping natural selection acting longer. And the only way you make natural selection powerful for longer is to be reproductively viable for longer. And of course, in the case of women with menopause, that means it had to have been, because that's ancient, it had to have been indirect reproduction. Males is a little more iffy, but even with males, I think it's largely true because before there were social hierarchies and stuff where there were kings and emperors, in order to have access to further reproduction once you were 40 or 50, you had to fight with the young males, and that wouldn't have worked out very well. So the older men, I think, would have had to have helped also. And so this indirect reproduction by helping kids that are already produced is what kept natural selection stronger for longer. And then that's actually what propelled the doubling of our lifespan compared to all other apes.
mm,
And so, nothing in biology happens without mechanisms. And so you have to have underlying mechanisms that prompt you to do those things. Because, I mean, let's face it, it's hard work for everybody to take care of. A 3-year-old who's running around screaming, I don't care if you're a 25-year-old mom or a 65-year-old grandpa, it's still hard work.
mm,
And so if you weren't rewarded for that emotionally, if you didn't feel this strong bond, this love, and so on, these are all evolved mechanisms. If all those things weren't there, we wouldn't do it.
mm,
And so all these mechanisms co-evolved along with our helping in old age. And so it's not surprising at all that you see grandma on the street with her grandchildren and she's got a big smile on her face, because that's really what she's evolved to do. And we're not slaves to our evolution. I mean, we don't. there are a lot of, we have free will, but those mechanisms are there. We've evolved to get pleasure out of doing it. So, as I was saying at the beginning of this, there are a lot of elderly people, including grandmothers, who are on antidepressant medicines because they sit in their house with, nothing to do or nothing useful to do. And boy, if they had their grandchildren nearby, and they were able to help out several hours a day, several days a week, that just really increases their happiness too. So there's incentive on both sides. The older people would be happier, and certainly the moms and dads would be happier too, if everybody chipped in and helped out.
Yeah, that's actually really interesting. I've got 2 points to add to what you've just said. I do remember actually a study going around. I can't remember the details, but the headline of it was that grandparents that spend time with their grandchildren have a longer life expectancy, which I guess definitely backs that up. And 2, there was an initiative put somewhere, oh my gosh, it's just come to my mind and I can't remember the details, but there was an initiative put in somewhere where they had like children from a daycare center go into an old people's home, and they just found that like the bond between the elderly and the children, like the young children, was insane. Like they had the elderly reading to the children, and it really just like brought the mood up for both parties. So I can't remember where that was, but I definitely would love to
many
see
studies.
that.
There's been shown many times. They bringing children in, and the old people just really light up. There's a scholar. I don't know if he's an anthropologist or an evolutionary biologist. I forget. I should know because I've talked to him many times. David Coles is his name, and he's Australian, I think. He lives there, and he's done a lot of work on satisfaction in older people if they have grandchildren around to see and help all the time. And they're very well done studies. There aren't enough people doing these studies, and as David himself and his co-authors admit, it's not perfectly clear whether older people who have grandchildren around are happier just because they're helping their grandchildren, or they're happier because they're healthy enough to be around to help their grandchildren, that kind of thing. So there are some confounding variables that need to be teased out. But unfortunately, this sort of idea isn't on the radar of mainstream medicine. Mainstream medicine says, here, take this pill, you'll feel happier. They don't look at the broad picture here, such as the one we're discussing, where we're considered to be too speculative or these things need to be tested more. They are speculative or theoretical up to a point, but that's the way science works. You have ideas, and they start as speculations. You test them, they become more solid. More and more people get on board. They get tested further, and then they become known facts or close to facts. So that's why we would like to get more people involved in doing this kind of research, this kind of stuff that David Coles is doing. So
yeah, one other point that I'd love to put in there, which isn't really about children, but more about the kinship networks and living close to relatives and having the input of your own mother, father, like the grandparents, brothers, sisters, uncles, aunties, is that I know, at the moment, a lot of chatter is in the intersphere about like masculine roles and feminine roles and what toxic masculinity looks like. And I just feel like in relationship, if there were toxic components, that would be teased out quite quickly if you're regularly with your relatives. So like rates of domestic violence, for instance, would probably drop significantly because you have multiple people in that situation keeping an eye on it. And likewise, like child abuse happening within the home would be a whole lot less.
Yep. Yeah, I mean, there are, some people, we can call them bad apples or whatever, and or they're even just having a bad day. And if somebody's there to be watching and relieve the pressure a little bit and say, here, let me take the little one away because you're obviously having a bad day, that
Mm.
those kinds of things can be very helpful. It gives people a minute to take pause and collect themselves and so on. I mean, none of us are perfect. We all fly
Mm.
off the handle once in a while, and having others there to watch us can kind of tempers that, I think. Yeah. So.
Yeah. No, amazing. Um, in terms of alloparenting, where can we, I guess, introduce that model? I mean, if we have families that have moved away from their extended families, where could we introduce that model? Does daycare do any justice to alloparenting? Can it be a substitute? And if so, why? If not, um, what are the detriments for childcare?
Yeah, I mean, I think, yeah, I don't want to paint with too broad of a brush. I mean, there are probably good daycares and bad daycares, and some of the daycares, um, they, they have lots of caretakers, and they're committed, and they're and I also like it when they mix up the ages of the children a little, because the 3-year-old really can help the 2-year-old, and those sorts of things. They can be helpful. I think that it's rare that they approach the ideal or the more ideal situation that we find in when kinship networks are intact. But I think that situation is far better than a single parent home alone with 3 children or 4 children with no help.
Mm.
So there is a role for that, for hiring people and having people, um, uh, paying people to help out. And um, uh, yeah, I think it can be overdone. I don't. There are problems that even the best daycares have trouble overcoming, and one of them is infection. You put a bunch of kids together, and if one has a cold, then pretty soon all of them have a cold. Even if you try to practice good hand washing and stuff, it's pretty hard if you're dealing with 2-year-olds and 3-year-olds. So this is one of the problems that people run into. They're paying a lot of money for a good daycare, and then they can't take their child to the daycare half the time because the child's sick. And so then they have to miss work, and so on. So it's just so much better if grandma or auntie or grandpa were available to help out, or a whole host of kin like we used to have back in the day. But admittedly, it's not possible for some people. They have to, they have a job somewhere, or they have to go to school somewhere, or they have to move away from their kin, and we have to understand that, and we can't, you know, be too critical of people who don't stick in their native community.
Mm.
But I do think that, um, in my book, and people like you who are interested in this, we can point out the positives of it, and so in that way entice people, or sort of gently push them in that direction.
Mm.
When my daughter and her husband first had children, or she became pregnant, they decided to move closer to us, back to where they both grew up. So uh, we could help out. Now they have had lots of opportunities. They were able to work remotely and so on, and they've had advantages that I know not everybody has. My son, on the other hand, he's lives a few hundred miles away from us because of his job. But my wife and I, we take every opportunity to go there and hang out with the kids as much as we can. So
Mm.
uh, we're there to help out, even though we don't live, within driving distance of them, on a daily or weekly basis. So I think if more people sort of made the effort, And again, they can make the effort selfishly because it's going to make them happier.
Yeah.
You know,
I I find that actually a lot of I've been toying with the idea of how individualized society is, and our culture promotes a lot of individualization. And actually, when you look at research and like history throughout, the commitment to community and actually giving is
yeah,
almost selfish because it's so much better for you. You get
it really,
all the happy
yeah,
hormones
sure,
if you're able
yeah,
to give and provide for your community, for your family, for all of and you know, I'm not personally religious, but when you look at religion and so many people moving back into religion, like that's one of the core foundations of religions, a lot of
sure, yeah.
giving. So no,
It
I
creates community. Yeah, yeah,
yeah, and so obviously, yeah, I feel like with family, you can tap into building those hormones and building that health, like if for
yeah,
lack of a better word, yeah, just by being around your family. And also, I mean, I look at a lot of mother-child diet and like within the family and like hormone health within just the practices we do day to day. So
right.
it makes so much sense that, and you know, I guess what all the attachment styles and like healthy attachment and that being around like your children and your children being around you. So it makes sense that that would extend to extended kinship networks as
Yeah,
well.
no, yeah, I think you're right. Yeah, like I said earlier, everything in biology works based on mechanisms,
Mm,
and so it's the hormones and the neurotransmitters and all of those things get stimulated. Um, uh, you can make analogies to the more physical stuff that people understand, like if you stick your hand in a fire, you feel pain, and if you pull it back out, you get rewarded by feeling better. And sort of our mental interactions, the emotions that guide us, sort of work in the same way. So
mm,
so I think just getting that word out is helpful. And of course, everybody has their own constraints that they have to deal with, and so
mm.
on. But yeah,
Akashia, how great is the quality of your new podcast, Return to Wisdom? Oh, mate, I know. I have been recording at Byron Bay's premium content and podcast recording studio, Pod Byron. They are epic. It's new, it's fresh, it's legit, as you can see. If you want to upskill your brand, if you want to create a course online, this is the place to do it. Jump on at podbyron.com and be sure to check the show notes for a sneaky little discount on your first session. Pod Byron is where it's at. You.
one thing that I talk about in this book that I think is very important for parents as their children grow up and as we move into the grandparental stage and so on. In the U.S., I think maybe more than where you're living, but we have, there's just a lot of health issues that come on early on when you're, in your 40s and 50s and more so in your 60s and 70s and it really makes it hard for a lot of people to be effective contributors to the kin network, to the family. And so one of the things, if we're trying to incentivize people to try to be a little healthier, and it would be so that they can continue to be assets rather than liabilities to their family. So I think it's one of the again, it's sometimes hard to get people to think long term and to do those things. But if even some people wake up in the morning and say, I want to be around for a while, and I don't want to be cared for. I want to be a helper. That's incentive to get up and be active, and it's incentive not to eat that extra donut or whatever. All of those things are problems here in the U.S. that really are keeping a good number of potentially helpful alloparents from being able to help as much as they would be otherwise. Of course, we all get old, and you eventually have problems, but you can delay them, and you can work towards being an asset. I think that's very important.
In the way of health and looking after ourselves, I guess one thing that I have really noticed is children with developmental delays or retaining certain reflexes. And I was wondering about the evolutionary biology side around that. And if what we're seeing today is normal, and if not, why not? And what can we do to prevent or help our children to reach those milestones at an appropriate age?
Yeah. Well, um, there's a lot of variability in children, just like there's a lot of variability uh, in the phenotypes of adults. Some people are tall, some people are short, some people are light, some people are dark. All those kinds of things in our brains are somewhat variable. So the first thing I think to say is that, um, yeah, everybody's brain is a little bit different, and a lot, everybody can have different strengths and weaknesses, and that's just fine. But in modern settings, um, some of the weaknesses, some of the things that are just differences get labeled as weaknesses today, because we try to funnel everybody through the same system, through the first in preschool, then, and then kindergarten and later grades. Kids with brains that are sort of, very uh, easy to sit there and be still and focus and pay attention and so on. They get rewarded and they get called normal, whereas the child who wants to get up and roughhouse and run around and is really not all that excited about filling out another form for the teacher and so on, gets labeled as abnormal or having some type of developmental delay. And I think that's part of what we would call an evolutionary mismatch. We live in these environments where everybody's supposed to do the same thing, as children. Excuse me, but it doesn't really work that way. But on the other hand, there are some true developmental problems and issues that develop, I think, in part because of the way we rear children, especially early on. One of the things I talk about in the book is that, back in the day, children were held constantly. Children slept right next to mom. There were, the whole family slept together. There were no separate rooms in houses. There were no carriers we put kids in. There were certainly no, tablets or screens that we put, the 2-year-old in front of to babysit for a while we did things and so on. Children were always being carried about and in contact. And I think, especially early on, when you're an infant, the brain is extensively being developed and remodeled. And I think it would be surprising if we didn't find, sensory issues and things like that developing when we alter the cues that the children's brains are getting when they're very young. So there's not a lot of research on this, again, because it's an idea that only some people have started to talk about. Not just me. There are a few others, but things like autism, which is well. Let me just say, autism is hard to discuss because we've defined it so broadly now that everybody's autistic. So But there are people who have sensory issues where they have a hard time interacting, or they have a hard time with certain inputs, certain stimuli, and stuff like that. And I think some of that could result from the altered inputs that they got as very, very young infants. Um, and so some of the developmental delays or developmental problems that we see, I think, could arise from that sort of thing. But a good many of them are, as I first started to say, just because we live in a different environment and we sort of expect everybody to be the same, and when they're not, they get labeled as being bad or not quite normal or something. So
Yeah. So, I mean, what would your thoughts be on like certain devices that basically make baby stay put, or I guess, what are those? They look like little prisons, but they're like fenced off areas in the house where you put your baby to play so you can get things done. What
yeah.
would your thoughts be on those types of devices?
Yeah, no, I'm not a real fan of them. I mean, I can see a minimal role for them. Mom has to take a shower, and she wants to put baby in one of these little playpen boxes for 10 minutes. So baby's safe. I think it's fine. But if it's overdone, that's when there's a problem. I like to see babies. I tell the parents in my practice that holding babies and carrying babies is a lost art. We have them in our little carriers all the time. Of course, car seats are great. We have to keep them safe, but take them out of the car seat and carry them around and touch them and hold them and let them see and smell and hear language all day long, that kind of thing, and at night too. I think, yeah, like I said before, humans are very adaptable. We've survived all kinds of things that are a mismatch from our past, but on the fringes, at least, some kids are going to be thrown for a loop if we deviate too far from what those normal sensory inputs have been. So if you want to maximize the chances that your child doesn't have some sort of delay or sensory input problem or something, then you want to just be sure that you interact with them as much as you can. Now, there of course are much rarer genetic and developmental anomalies that are unavoidable. Doesn't matter what you do, but I think a lot of the things that are that we label as abnormal could be tweaked and improved just by mimicking past inputs a little bit more than we do.
Mm. And I guess on that, co-sleeping, which is a contentious topic, maybe not so much in my area, but I guess more broadly, socially. What are your thoughts on co-sleeping?
Yeah, well, I think co-sleeping is fine. I think that well, you have to co-sleep safely, and that's the problem. The American Academy of Pediatrics has to speak for the whole U.S. And there are situations where it's almost impossible to do it safely. If mom's a drug addict or dad's an alcoholic and all you've got to sleep on is a couch, it's just not safe. But if you co-sleep safely, it's safe. I mean, yeah, that sounds like a truism, but the backdrop is that, for all of our evolution since we split off from the other apes and before, co-sleeping was the rule. Mm-hmm. And there are countries where it's done. Japan is one of them where they're it's very, very common. It's becoming maybe a little less common in recent years, but it's very, very common. And they have less than half the infant mortality rate that we do, and less than half the sudden infant death syndrome that we do in the U.S.
Mm.
So if co-sleeping itself is the problem, why is that when they're all co-sleeping and they do so much better than we do? It's not co-sleeping, it's co-sleeping unsafely that's dangerous.
Mm. I
Uh,
actually heard of a study. It was another pediatrician I was listening to, but again, I can't remember his name. Um, but he was speaking about a study of where they were actually measuring mum's CO2 levels, and it was like like mum breathing on baby during the night was actually
yeah,
activating baby's breath to keep going, and they were thinking
sure.
that was
Yeah,
one thing that
yeah,
does mitigate SIDS. So
yeah,
if baby's in a crib across the room or even in another room, it's a bit hard
sure.
for them to read your CO2 levels to help get
Yeah,
them inward breathing.
yeah, no, I think that's absolutely true. And torticollis, the neck tilt that a lot of babies get,
Mm-hmm.
or and the flattening of the head that's very common, at least in the US and I think in Europe. All those things are prevented to a very large extent by co-sleeping because you're always changing positions. Videotape studies have shown that moms, even when they're asleep, they sort of curl around the baby and pat the baby, and they're sort of checking, and each one is getting a little stimulation and so on. And I think that anybody who says co-sleeping is a terrible thing has to reconcile with the fact that we've co-slept for millions of years, and that we've co-evolved lots of different other developmental inputs depend on that co-sleeping. And um, uh, but again, we have to be very careful because we don't want people to co-sleep in an unsafe situation. And
Mm-hmm.
so, if you have a few martinis before you go to bed, don't take your baby with you. That kind of thing.
Yeah.
So
I would also and I have no evidence backing this, but I guess women who have had births that are more traumatic and have involved maybe surgery or quite a lot of pain relief, that could
mhm.
also be detrimental to co-sleeping for those first
Yeah,
few
sure. Oh, absolutely,
weeks. Mm.
absolutely. Yeah, they're on pain medicines and they're in pain themselves, and yeah, absolutely, you don't want to do it in those kinds of situations. That's a nice case for dad or grandma to step in and help out for a few weeks there, or something like that.
Absolutely. And how do you feel about sleep training and feeding schedules, and how would this, I guess, not work so well with biology and the way we have evolved?
Yeah, I'm not a huge fan of this of sleep training. You can do it. I mean, again, I'll come back to this. Humans are flexible. We can go through a lot of hardships and abnormalities and mismatches and so on, and still come out all right. I mean, sometimes I'm just, if I look at history, I'm very surprised that the adults who lived through the killing fields or whatever, and that most of them are still okay anyway.
Hmm.
So yeah, yeah, we can deviate a lot, but if you're trying to uh, optimize the situation, then I think by hewing more to the way we used to do things can be beneficial. Yeah.
Mm. So, if we were to go for like feeding schedules, for instance, I mean, I would imagine historically breastfeeding never used to be as much of a um, issue as what we find it is now. A lot of women do struggle with their breastfeeding journeys um, and find that maybe baby won't even attempt to take the breast. So in terms of and often I see these women are encouraged to pump and use a bottle and until their milk comes in or things like this. How would I mean, is there some way that we could mitigate that when we look at how evolution
I
has?
think so. Yeah, modern medicine interferes. They, even lactation consultants, I think, could learn something about going and living in a traditional society for a while. I mean, first of all, the big problem is, we grow up and we don't have modeling. We don't see breastfeeding all around, so it seems like a sort of scary new thing for these new moms, and so they go to classes, and then that those are good in a way, but sometimes they just instill more anxiety and worry. And then a lot of the experts say, well, you have to have this breast pump and you have to keep a schedule and you got to, get your Excel sheet out and tell me how many voids there are and how many poops there are. You got to keep track of it all, and you got to have the baby weighed all the time, and all these different things that potentially interfere with breastfeeding by a mom who's already kind of nervous and anxious about it because she hasn't grown up with it. And so I think when people parents come into my office with their spreadsheets, and I tell them to get rid of your spreadsheets. You just do it. Just keep baby with you, and in the first couple of days of life while you're trying to get things going, you do have to wake baby up sometimes, baby sleeping and so on. So, we sort of lie when we say feed on demand or early on, but after a few weeks and you get it going, if baby's healthy and doing well, you relax, you feed on demand. And there's if you go to traditional societies, breastfeeding failure just almost never happens. It's because everybody around you has experience with it. If you're having a little trouble, grandma says, here, I'll show you how. And, or older sister does those kinds of things. So, doctors are a big part of the problem. We worry about jaundice. And so when a baby looks a little bit yellow, we say, if you give the baby a little formula, that'll help clear the jaundice a little faster. And it does. But breastfeeding is a feedback mechanism, right? The hungrier baby gets, the more baby sucks. The more baby sucks, the faster and better the milk comes in. So if you introduce formula, I'm not saying there's never a rule for that, but if you do it too much, too often, you're just short-circuiting the system. And then baby learns that, well, I'm not going to suck on this breast where there's not much there. It's hard work. Give me that bottle. They learn to prefer that formula. And then, pretty soon, the parents come back at the 1 month visit and say, well, we decided to do formula instead. And a lot of times it's all because that doctor told them, well, the baby looks a little bit yellow. Usually the jaundice is physiologically normal. There are certain cases where baby has an infection or there's an immunological incompatibility between mom and baby's blood type where you can get really high levels of bilirubin and a lot of jaundice that can cause terrible problems, irreversible brain damage. So it's important that we keep an eye on those kinds of things. But we need to do it with a little bit more respect for, the way the system is really supposed to work. It's just not very common to have, babies have immunological incompatibilities with mom after, if you haven't discovered them after a few days, they're likely not there. If it's physiologically normal for baby to be a little bit yellow for the first 5 days or so. And so you never say never when it comes to introducing formula, but we just do it far too often, far more often than we have to. And it's just another way we inject anxiety into the system and that, interferes with breastfeeding too.
Yeah, I look, as someone who has 5 children and all 5 of my children did look a little bit yellow in the first few days of life. I do wonder if perhaps there is like a pigmentation, like a skin pigmentation that might make baby look yellower than like one one person's baby look yellower than another person's baby.
Well, yeah, I mean, light skinned babies, you can see it easier, but you can see it in the whites of the eyes of dark skinned babies too. But bilirubin, maybe this is where you were going, which is what causes the yellow. In breastfed babies, it stays somewhat elevated compared to older children and adults for about a month or even 6 weeks or so. And that's because there's a mechanism in breast milk that causes some of the bilirubin to be reuptaken by the gut and put back into the system. And that's an adaptation. And so that tells us that a little bit of bilirubin is a good thing for baby. And we think it is that bilirubin acts sort of like an antioxidant, like vitamin C or vitamin E, which is protective to babies when they're real little, when there's a lot of cell division, growth, and development going on. So babies who are fed formula miss out on that little bit of protection. So you can see maybe in the whites of the baby's eyes up to a month or so, you might see a little tinge of yellow in there for a while.
Yeah. Well, I feel like, again, breastfeeding is something that has got more and more research backing it every day, and the magic of breast milk for babies. In terms of extended feeding, there was a clip that actually went viral on social media of some prominent voice who was saying how breastfeeding a child beyond 6 months is actually quite selfish of the mother because you're creating problems like attachment problems. They're going to get addicted to boobs. It was depending on where you sit on the breastfeeding spectrum. Where I sit, I've been breastfeeding for 10 years straight now, so I had a good laugh. But if you were a vulnerable mother with your first child in your first 6 months of your feeding journey, I mean, what kind of advice would you have for those mothers?
Yeah, well, I mean, I can see that if you're a mother who's having lots of problems, you might want to agree with that. It would kind of rationalize the not stopping or something. But what I tell parents is that historically and prehistorically, for millions of years, we've breastfed it's normal to breastfeed for a couple of years, and babies are sort of designed to do that. And mothers' reproductive and endocrinological systems are designed to experience lengthy bouts of nursing over the lifetime. I mean, you probably know that breastfeeding is protective for breast cancer. There was a really cool study, and I'd like to see it replicated, published in Evolutionary and Public Health a couple of years ago, producing data showing that mothers who've breastfed for a long period of time have lower risk of developing Alzheimer's disease or other forms of dementia. So again, there's some type of potentially some type of hormonal neurotransmitter type feedback going on there, something that's good for the maternal brain. If 20 years after you've breastfed your last baby, you're still getting some kind of benefit from that. So I would list the benefits, to parents, tell them historically that it's not weird for babies to breastfeed for a couple years or even longer. Then, like you, I would laugh at people who say it's ridiculous to breastfeed for more than 6 months because they get too attached to boobs or whatever. I don't know.
Actually, speaking of Erica Commissar, she actually talks about in Sweden, because the policies for maternal and paternal paid leave post-baby, I think the way it works is that mum gets to stay home for 6 months and then it swaps and dad gets to stay home for 6 months. And because of that, they actually encouraged women to stop breastfeeding, or they have advertisements saying that only 6 months of breastfeeding is fine and then babies should move on to a bottle. which I guess then backs up their policy. So I know that, there's one school of thought that's like, oh, okay, this information is silly, but then there is another school of thought where it is promoted in some countries in order to be able to get your paid parental leave.
Yeah, well, I mean, to be fair, we do have alternative sources of food that weren't available in the Pleistocene. We do have formula, which is tries to mimic breast milk to some extent, doesn't completely. And we do have moms who have to go back to work and so on. And we do have alternative foods that are available. We can start feeding solids, and things like that. So I don't think it's absolutely crucial that you breastfeed for 2.5 years, like was typical in the Pleistocene. But I think there's absolutely no reason to say that it's psychologically or health-wise beneficial to stop at 6 months. Either it's not beneficial for mother, it's not beneficial for baby. I think you get the most bang for your buck out of breastfeeding in the first 6 months, but nonetheless, I don't think I think the benefits continue, and I think that's been clearly shown by the data.
Well, thank you, Dr. Paul. I feel like I've taken up enough of your time. But I do really love the picture that you paint when we're looking at how we developed evolutionarily, and I guess where introducing certain systems have sent us back health-wise and happiness-wise, and how we can hopefully mitigate that and bring back more traditional ways of living to, help with everything.
Absolutely. Well, it's been a real pleasure talking to you. I'm so glad to hear that you have 5 children that are healthy and doing well. And they're a lot of work, as you know, but they're a great joy. And hopefully you have some help with, how old is the oldest one now?
She is nearly 10. So we'll go 10 years of breastfeeding.
Okay. Oh, there you go. Yeah.
But no. Could you please let the listeners know your book, where to find more information about you, and any offerings you have?
Yeah, sure. So the name of the book is Bringing Up Baby, An Evolutionary View of Pediatrics. And it was published in January of this year. And it's available through Amazon. 3 forms. So you can get it, the Kindle version, the paperback, and the hardcover. It's not very expensive. I think it's very easy to read, actually. Somebody was telling me yesterday that she had her husband read it, and he said, "Well, I feel like I know that guy," because I try to be very just sort of, conversational. It's not highly technical. I do explain how evolution works to some extent, but I think people will like the book, so they can get it on Amazon. You can go to my website, which is just my name, www.paulturke.com. Turke is Turke, and you can call me Turkey if you'd like. And you can go to my pediatric practice website. It's I work with another fine pediatrician named Suzanne Tomashow. It's Turke and Tomashow Pediatrics, and you can get to our website. It's called dexterpediatricians.com. And you can even my email is on my website and so on. You can email me, and I can try to answer questions. I can't tell you whether it's important to take your baby to the doctor in the next 2 hours because she has a fever. I can't answer those kinds of questions, but I can answer general types of things like what are the benefits of breastfeeding or something like that. So please feel free to contact me. Okay.
Amazing. Thank you so much for that. That's very generous of you. I'll also mention that you did a great interview with Chris Williamson on Modern Wisdom, which is how I found you and found all your work, which is amazing. But yeah, thank you
Yeah.
everyone for joining us, and
Yeah.
we'll see you next week.
Yeah. Chris is a great guy, and you did a great job too. So thank you very much. I really appreciate it.
Thanks for joining me today. If this ignited a flame for you, please share, follow the show, and leave a review. The more support and subscriptions the show gets, the more powerful and credentialed guests I can bring on to deepen these conversations. I appreciate you being here, and I will see you next week.